Hi friends. Now in DAMS Unplugged series, we have initiated a series of clinical case discussions where we try to integrate the clinical findings with the image-based findings, and we try to give you an idea on how to approach the case. Today I have selected a relatively rare case. It's a rarish case, but it has some interesting findings. So I thought it might be of interest to the listeners who are either medical students or residents who can take some key take-home points from it. It is a very interesting case, but rare. Let's try to see it. Okay. So we have a 3-year-old child with developmental delay. This is the history given to us. 3-year-old child with developmental delay. And let me show you the images. An MRI brain was done because of this indication. And you can see for yourself, this is the axial T2 weighted MRI of the brain. The darker thing that you see is the cortex, and this is the CSF. These are the thalami, the basal ganglia, and this is the white matter. Normally on a T2 weighted image, the myelinated area should be appearing more dark as compared to the gray matter. Here you see the entire white matter is more white. It is hyper intense as compared to the gray matter. And usually at the age of 3 years, you should have achieved adult myelination, because adult myelination on MRI is seen after the age of 2 years. This is the child with 3 years. So we are feeling this is to do something with the myelination. And let's look at the further images. We have another image with us. This looks like a perfectly normal image till the time you see in front of you that this is a T1 weighted image. Now this T1 weighted image is actually looking like a FLAIR image. I hope you notice that when we saw the image, you thought probably it's a normal FLAIR image, but it's actually is a T1 weighted image. On a T1 weighted image, the white matter should appear more hyper intense than gray matter. That means the white matter should have been more white. Now you can see now again the entire white matter appears abnormal. So you can see now another image. Now this looks like a perfectly normal T1 weighted image before you look at the label on the top which says it is a FLAIR image. Now a FLAIR image is looking like a T1 weighted image because on a FLAIR image the white matter should have been dark. Here it looks hyper intense. So this is a patient where at the age of 3 years you have almost complete lack of myelination. What could it be? This condition is called as Pelizaeus Merzbacher disease. Now what is Pelizaeus Merzbacher disease? Let's try to understand it. There is almost complete absence of white matter myelination, and please note the age of the child was 3 years, while the adult myelination should have been reached by 2 years of age. It's a rare leukodystrophy and it's a primary hypomyelinating disorder. So there is primary hypomyelination happening here. The defect is in a X-linked defect, which is in the proteolipid protein PLP1 gene. That is the defect responsible for it, which leads to impaired oligodendrocyte function, which leads to complete absence of myelination. But however, there may be some sparing of myelination around the perivascular areas, which may lead to a tigroid appearance in some patients, while the classic cause of tigroid pattern in leukodystrophies is metachromatic leukodystrophy. Keep it in mind for future exams. Pelizaeus Merzbacher disease is also a cause of tigroid appearance on MRI, and this is one of the hypomyelination disorders. It looks like a perfectly normal, a T1 weighted image looks like FLAIR, or a FLAIR image looks like a T1 weighted image. And if you notice the image which has been done, that is the clue to the diagnosis in the end. I hope you enjoy this Unplugged series. Do write to us in the comment section for any more videos or any more suggestions that you have for us. I wish you all the best. Do follow us on the DAMS Daily channel on YouTube. Thank you.